Howdy friends, your city manager Seth Sumner here with you, Wednesday, April 22nd, 2020 with your daily COVID-19 update. I'll start, as I always do, with the Tennessee Department of Health data and showing you today, we see right here, once again, we're continuing a wonderful trend here in McMinn County with staying at 6 COVID positive persons. You've done a wonderful job getting out and getting tested, going to the health department Monday through Friday, 9 a.m. to noon. And also this past Sunday, we had a really big drive-through set up with the help of the Tennessee Department of Health and the Tennessee National Guard, setting up a station out at Athens Regional Park where we were able to test 334 McMinn Countyans and Tennesseans. And so those numbers are not reflected in this data. However, the folks that did attend that drive-through have gotten their results back already. And so we heard from some of those folks last night self-reporting to us that they did the drive-through on Sunday, and yesterday they already had their results. And everybody I heard back from was negative. So that is a blessing. We're happy to hear that. We look at our number of cases across the entire state, 7,842. We're sad to say that deaths have increased again, but still looking at just a very small increase. Nothing like the projections that we were seeing early on from this virus, and believing that it may be affecting, if one infected person were to go unchecked, unquarantined, that they had the likelihood of infecting up to 5 other people. That would have led to a lot greater deaths, a lot greater infection rates, and we're very fortunate that that is not the case today. That one person infected, they're quarantining, they're doing what's right, we're catching it early, and they're only having an opportunity to infect 1.5 people. So that has made sure that our hospital and ICU resources have remained at an appropriate level. They've never been in harm's way as far as overuse. And so we do have the hospital beds, the ICU units, the ventilators that are needed to take care of those acute cases and the non-acute cases. And largely that's what we're seeing, non-acute. Those folks that don't need hospital time, they just need quarantined and they're able to get over the symptoms on their own. And so that has been very good. So here we go. We're looking at our total numbers of 7,842 total infected through today, or total positive, and only 775 people being hospitalized through that. So 10% of cases requiring those hospital stays. One of the wonderful numbers that we like to look at every day, and we like to see this one continuing to grow, is the recovered. How many of our 7,800 infected have recovered so far? Over 4,000. So over half, 51%, of all COVID positive tested Tennesseans have fully recovered from COVID-19 at this point. And we want to see that continue to increase. We were at over 110,000 tested Tennesseans yesterday. We're now right at 115,000. Continuing to do a lot of testing all throughout Tennessee, and especially here in McMinn County. You've done a wonderful job of getting tested. And so that is good data to have to make sure that our population actually is COVID-19 negative. That's important to know. So we like to look at this every day. We still are at 4 fully recovered out of our 6 total positive, and that's 743 tests in McMinn County. We do know this number is higher, and at some point that will be reflected in the data because of that 334 that were tested Sunday, and then some of the others that are being tested through the health department, and there are also private practitioner tests that are being conducted as well. And so we want to make sure all that data comes through. It takes a little while for us to get it and get it loaded and share that with you, but this is where we stand at reporting today. So great job, McMinn County. Great job, Tennessee. Close that down. Well, let's jump over it because they did update. We have been looking at the University of Washington numbers, and last time we looked at this, it had been a couple of days since they had updated. They updated yesterday evening, and so we do see the mass gathering restrictions that were placed March 23rd. Initial business closures March 23rd. Those are executive orders from Governor Bill Lee that we're abiding in locally and we're able to enforce locally. Educational facilities closed across Tennessee March 20th, but in McMinn County that was actually March 13th. Our school districts got together and went ahead and closed ahead of the order. Non-essential services April 1st and stay-at-home order on April 2nd. So here we are on the 22nd, 20 days after the stay-at-home order. So we're right here on 3 weeks, and the stay-at-home order continues to be effective through April 30th. So all of those non-essential listed businesses that were included in the governor's orders, the hair salons, barbershops, tattoo parlors, tanning salons, massage parlors, any of those type of businesses that require personal touch are to remain closed until at least April 30th. And we'll talk a little bit more towards the end of the update today about what that may be looking like over next week and the week after, what that's going to look like. Because we don't entirely know yet, but I'm able to inform you what I do know and what I can share with you. So stay tuned for that. But we looked at these models. Our deaths per day peak has already been reached 8 days ago. That happened on April 14th, actually, where we had that one double-digit spike in deaths. There was a 14% increase in deaths on that one day. 15 Tennesseans lost their lives to COVID-19 on that day, but we've seen better numbers since then. Single-digit increases and very small increases, and so we're sorry to see anyone perish from this virus. We don't want to see anybody sick from this virus, but it's unfortunately something that we're having to deal with right now. So our thoughts and prayers with all of those whose lives have been touched during this time by this virus, and we're just very thankful that McMinn Countyans, Athenians are doing their part by staying apart and having lower infection rates than a lot of our neighbors, a lot of our friends, even in Tennessee and across the United States. And so we look at this modeling. You can see how we have dropped sharply from our previous projections, and now we are looking ahead into May and June and July for a containment strategy. And I know our governor and a select team of leaders across the state of Tennessee are working on that containment strategy right now. Hospital resource use, nowhere near our limit, nowhere near. 282 beds out of the 7,812 needed. That's wonderful. We're not stressing our resources. And then also past peak, 18 days past peak resource use on this. And then we get down to the total deaths. This was almost 5,000 was the initial projection when we started looking at the onset of this pandemic for Tennessee. And here we are projecting, and this is a guess, this is a projection of 235. We're not there yet, and I hope we don't get there. Let's keep those things level by being responsible, doing our part by staying apart, and honoring the stay-at-home order and helping our neighbors in need. That's what it takes for us to be successful, to make sure that we stop the spread of this virus and we come out of this thing on the other side still engaged in good hygiene practices, still probably some level of social distancing into the near future until we can get a vaccine in place, before we can get a real grasp on how to properly handle this out into the future. So with that, I do have a special guest with me today. who I will welcome to the table. And as we get set up, there we go.
Thank you.
Yes, sir. All right, Athenians, it's a real treat to have Mr. Glenn Czarnecki with us. He is the director of the Southeast Tennessee region for the Department of Health. And so Glenn has actually been hands-on, which is maybe we need a new saying after COVID-19, but he's absolutely been boots on the ground. He was here Sunday all day, getting set up, even helping clean up after the drive-through assessment center, and so he's been all over the region, all 10 counties in our southeast region of Tennessee, which does not include Hamilton.
Correct.
And so you take that population out, but southeast Tennessee, other than Hamilton, is that area that he is the director over for the Department of Health. So Glenn, welcome. Thank you for being with us.
Sure.
And I think a good opening for our friends that are watching, maybe a little bit of description of your role in our region and the Department of Health, what you conduct here.
So the Department of Health, there's 95 counties in the state of Tennessee, and the Department of Health is broken into basically 6 metro health departments and 7 rural regions. So, of course, one of those 6 metros would be Chattanooga-Hamilton County, and while our office is actually in Chattanooga-Hamilton County, we then manage and help run the 10 rural county health departments in the surrounding counties. So, kind of working from east to west, Polk, Bradley, McMinn, Meigs, Ray, Bledsoe, Sequatchie, Grundy, Marion, and Franklin counties. So it's a population of about 330,000 Tennesseans. It's actually, ironically, very, very similar to the population of Hamilton County alone. But that's how the state has broken up those regions, and so we have that responsibility. We have about 210 employees across that 10-county region, about 40 of which are actually in our regional office and help us run some of the regional, direct some of the programs that we offer at all the local health departments, but the regional office is there really to support what happens at the local health department level. So here at the McMinn County Health Department, of course, we have County Director Jeannie Bentley, who does a great job. She has an excellent staff there, and they were all in place on Sunday to help us with this surge testing event. We really appreciate the support we got from the City of Athens, from McMinn County as well, the County Mayor's Office, the Sheriff's Department. We had a tremendous amount of support. EMA, we really had an outstanding event, and it really turned out to be a great, perfect venue for what we needed to do as well.
It was, and I was really most impressive to me about the whole operation was how quickly you were able to conduct the tests. And what that ended up meaning is, kind of the last thing that we would want to consider is there may be folks that come wanting to get tested and we run out of tests or we run out of time or,
right.
Any of those kind of things, and that was not the case at all. Everyone that wanted to be tested got tested, and all within a timely manner.
And we actually started a little early. We had about 30 cars in line at about 11:30. So while we were supposed to start at 12, we decided we had all our ducks in a row. We decided just to go ahead and launch. And so I think by 12 o'clock we had seen almost 50 folks. And we did see things kind of wind down around 2:30. 3 o'clock was our quitting time, and we were able to stop there. And thanks to all the help we had from the National Guard and all, we were able to kind of gather our things up and left the show barn there in the status that we came to. And I think by about 4 o'clock we were out and had tested 334. So we were very pleased with that.
Excellent. And we're happy to be able to be part of hosting that here. Very small part of it, but
no, it was a big part, honestly.
But still very helpful to get that population tested.
Absolutely.
And speaking of testing, what are the ways that people can get tested right now?
So right now in our region we have 6 drive-through sites, 4 of which we're getting National Guard assistance. Those are Franklin, Sequatchie, Ray, and here in McMinn County. So we have National Guardsmen that open those drive-through sites every day, 9 a.m. to noon, Monday through Friday. And then we have 2 additional sites in Grundy and Bradley, where those 2 are also 9 to 12. They're actually run with strictly health department staff. The other 4 counties in our region, if folks have issues, mobility issues, transportation issues getting to those drive-through sites, we can also test at those health departments. What we're asking is that people call ahead and give us some idea of when they can arrive, and we can also test them at those sites as well.
Wonderful. Are you testing folks? I don't have any symptoms. Can I be tested?
When we first started testing, gosh, I guess it's been 5 weeks ago now. It seems like a year, but about 5 weeks ago, we started testing, and our supplies were very, very limited. So we had to stipulate, certain symptoms if they've been in contact with a positive patient. Really, when supplies ramped up dramatically is when we sort of lifted those restrictions, and we're now willing to test anyone who would like to be tested. The idea being that the more we test the general public, the better we'll understand the burden of the disease, and hopefully not only contain that through our contact tracing, but hopefully then move in a direction that will allow us to sort of get back to some level of normalcy and get on top of this thing.
Wonderful. All right, so I can go to our health department right here in McMinn County, 9 a.m. to noon, Monday through Friday, do a drive-up test, takes less than 5 minutes, if that. But how much does that cost me?
That will cost you nothing.
Nothing.
It's absolutely free.
Not even for the lab results?
Nothing. Absolutely nothing.
Absolutely free.
Drive up. We'll probably give you a cell phone number to call through your windshield so that we can reduce that contact. We'll give you a cell phone number to call. We'll get you registered over the phone. That takes probably 2 minutes, and you'll drive around and you'll get that nasopharyngeal test that has become so commonplace now.
Yes, wonderful. We've had some comments on that nasal test.
I understand.
Yeah, but I've heard some comments, and I guess it depends on who's administering it. But some folks have said it stings a little bit, and some folks have said not really.
Right.
Yeah, so
we've seen very little reaction. In 334 people, I saw very little reaction from anyone really. It looks far worse than what it is.
Yeah. It could be. It is invasive. So let's say, as far as testing goes, I'm an essential worker. I have to be at my job Monday through Friday, 8 a.m. to 5 p.m. Obviously, the McMinn County Health Department hours, although that's convenient locality for me, I can't get there because I'm at work. So if I can't get there, how else can I get tested if I can't get to the health department?
And that's why the governor really encouraged us about 10 days to 2 weeks ago to begin to have these weekend, what we're calling surge events, or we're really, the COVID-19 testing, just like we're doing Monday through Friday, but it's an attempt to get to have a bigger impact. So this last weekend, of course, on Saturday we had an event in Marion County, and then of course our event on Sunday here in McMinn. This coming weekend on Saturday, we will be testing in Bledsoe County at the Bledsoe High School in Pikeville, Tennessee. Again, we're going to start at 9 a.m. We're going to run that one until 1 p.m. And then on Sunday, we'll be testing in Franklin County in Winchester, Tennessee. At the fairgrounds, we'll be starting on Sunday at 11. We learned a little bit of a lesson from our Sunday here that folks could get there before noon on Sunday. I know a lot of folks are doing online church. But we're going to start at 11 and run till about 2 o'clock. And that will likely continue for the next few weekends until some of the restrictions have been lifted and we can get a better idea. The good news is, as you showed earlier, Seth, is this last weekend, the state of Tennessee, across the state with these surge events, we tested over 10,000 people.
Wow.
And those numbers of positives have not gone up dramatically. That's very, very good news, and that's what we want to see.
Absolutely. Yeah, let's continue that trend. We do that by doing our part by staying apart.
Absolutely, absolutely.
All right, so I've been tested. I know we had a lot of chatter early on about it taking several days for test results to get back. What does that process look like now? How soon do I get my test
That
results?
process has also improved dramatically. I'm very, very pleased to report that the vast majority of the 331 that were tested in Marion County on Saturday received their results the very next day on Sunday. Here with our event, because we had a Sunday afternoon event, the lab pickup actually occurred on Monday morning, and the vast majority, I believe, of those people had the results as soon as yesterday. So it's a very quick turnaround now, thankfully. There was a time early on where it was taking quite a bit longer, but we're very pleased to report that there's a very quick turnaround now.
Excellent. So we've also looked at the testing criteria. I know early on it was saying if you have these symptoms, please get tested. Now we're saying anybody that wants to be tested pretty well, get tested. Why has that changed?
A lot of it had to do with supply. Early on when we first started testing our region, our supply of specimen collection kits was very low. The state's done a tremendous job working with not only our State Department of Health labs, but also with private labs to get us additional supplies. And now we really seem to have more than enough. And we're getting more and more shipments every day. So once that supply chain really increased, we were able to move from just the very, very specific symptomatic with specific things to really open that up. And again, it's an effort to better understand that burden of disease so that we can quickly move to the contact tracing and investigating that, quite honestly, public health's been doing and does 365 days a year. Just so happens that right now we're doing it for COVID. Other times we're doing it for other communicable diseases that are with us all the time. So we're not doing anything unusual in terms of the contact tracing. We're certainly doing it at a much higher volume right now. What we've done is we've reconstituted many public health employees who maybe in the past were health educators or caseworkers, things like that, and they are now also doing that contact tracing. We've probably made, of the 150 some odd positives in our region, we've made over 3,000 contacts because each person who is reported as positive might have come in contact with 3 people in the last few days or 100 people, just kind of depending. As we've gone on with the pandemic, folks have obviously gotten the message that once you become symptomatic, you need to go home and quarantine yourself. So the number of contacts associated with the average positive now has gone down dramatically as well, so that really helps.
Wonderful. And that was something that I was unaware of, that was already a common practice for our health department, with a number of other things that happen probably annually, is contact tracing, because it's natural when folks hear something we're unfamiliar with, it's scary, it's different, and you hear, okay, now McMinn County has its first case. Well, who is it? And obviously we can't share who they are. There's a lot of details that we can't share, but knowing and personally just being comforted that there's a team in place, there's a process in place where once you've identified a COVID positive person, or for this matter, a number of any other viruses, diseases, those kind of things, that you go with that person and retrace potential contacts, and then you have professionals that are calling those people who are likely to have been in contact with this person.
Exactly.
That's incredible. Do you care to expand a little bit more on that contact tracing?
Sure. Well, let me add too that each year the Department of Health puts together a list of what we call reportable diseases. And those diseases, that list goes out to private doctors, goes out to hospitals. And so those providers know that when they see symptoms related to these particular reportable diseases, we have to be made aware, immediately. Obviously, it really ranges from some diseases that are not as contagious to others that are very, very contagious. Measles is one in particular that thankfully we don't see a lot of it, but when we do see it, measles is highly contagious, so that's one that we need to know about immediately, and we need to be able to get on top of that. If someone walked in this room and there were 50 people in the room, the vast majority of people who did not have the measles vaccine, they could literally stand in that door, and the bulk of the people in the room might likely come down with highly contagious, much more contagious than even than COVID-19. So we're dealing with that, that kind of information all the time. So what we'll do when we get a positive case is we have someone very experienced at our health department that will reach out. Now we've got a handful of those folks in our regional office and throughout the region who will be the first person to contact that positive. We'll be asking them questions about who they've been in contact with and those kind of things. We then we build a database basically. A database of contacts. We then hand that, we have a contact tracing team, we hand that off to our team, and we have certain databases within the State Department of Health system and within our region where we use that to monitor, so we start calling those individuals. We've had to work with some sheriff's departments to let the populace know that when we call, this is a legitimate call.
Right. In
this day and age of bogus phone calls and scams and things like that, when someone calls you up and says you've been you're being notified that you've been in contact with a positive case, and we start to ask you some questions, that raises some people's hairs a little bit, right. And we understand that. But we typically try to then reach out to the sheriff's department in case, because we've had some people say, I'm going to call the sheriff, I know this is a scam. We understand that, but it's the best way for us to really reach out, and so we begin to make those contacts. We have every morning a conference call with our COVID-19 team, and our communicable disease director talks about the number of what we call closed, open, and new cases. New cases is obviously everything we've learned in the last 24 hours. Thankfully, that number stayed pretty stable for the last several days. But what I'm really pleased to hear is the number of closed cases, and closed for us means we've made every contact that we can possibly make associated with that one positive case. So we've called people, we've told them to self-quarantine, we're monitoring those people on a daily basis, and so even though it's not completely closed, it is, in our minds, it is everything that we can do from a public health perspective. And I'm pleased to say that on those daily calls, somewhere between 85 and 90% of our cases are closed. So we're getting new, we're jumping on those very quickly, and we're closing them out as quickly as we can. So it's a pretty impressive effort, quite honestly.
It is. I'll tell you, I am impressed. As a public administrator, it is so impressive, and I'm thankful that we have that in place. Or otherwise, it would be folks asking questions that we can't answer, and we don't have any way of knowing those things. But we actually know and work through. And so if you get a call from the health department, answer the phone, answer the questions, please. Because that's important. And if you're not getting a phone call from the health department, good job.
That's good news.
You've not been in contact with somebody with measles or COVID-19.
Right. Exactly.
Wonderful. And I probably did a very poor job yesterday of trying to answer a question about what is the definition of a recovered person. So we know we have 6 total people that have been identified as COVID positive in McMinn County, and 4 of those are listed as fully recovered. So maybe you can do a better job at explaining recovered than I could.
And I'll try. Recovered, as we understand it, the definition that we've given to the Department of Health is that it's anyone who is 72 hours fever-free, so 3 days after the fever breaks, and actually anyone who is 7 days past the initial onset of symptoms. So, and actually, the 72-hour thing has been almost changed to just feeling well for the last 72 hours. Of course, you and I both know that if you have a fever, you're not feeling very well. I know if I have a fever, my wife would tell you I turn into a baby, and I don't even get out of bed. Yeah. So they need to feel well for 72 hours and be at least 7 days past the initial onset of symptoms. Thankfully, on the website, you will see that the recovery numbers are going up dramatically, but understand that once someone is tested positive, that's kind of, they're typically symptomatic, and so the clock somewhat starts in that point. So you're really talking about it being at least a week afterwards before they could fall into the recovery category.
Good deal. Yeah, so that was a lot better than what I tried to explain yesterday. Yeah, thank you, Glenn.
Sure.
So I know there's a little bit of confusion. We're close to a couple other states here, not far from Georgia, Alabama, and sometimes news goes across state lines. I know Georgia has announced that they're going to open a little bit earlier than Tennessee, and especially some of those personal touch type businesses. And that is not the case for Tennessee. We remain under at least April 30th. All of those businesses will be closed. But the governor is serious about putting a plan in place that May 1st, some things are going to be opened. We're going to kind of be lifting this stay at home is what he's indicated so far. And so thinking about that and thinking about our future need of maybe social distancing, I guess to get to my question, has the social distancing portion of our stay at home, of what we're working on, that messaging, has social distancing, in your opinion, worked during this pandemic so far?
Yes, I definitely think it has. I think that, like I said earlier, we're testing so many more people now, and we're not seeing those numbers climb. I think had the governor and our local leadership and all not put those measures in place, as you mentioned at the onset of your presentation, I think we would have seen numbers dramatically higher, not only here in McMinn County, but across the state. I do think we will continue to see some type of social distancing put in place. I know that we can't necessarily anticipate that May 1st all the floodgates just fly open and we go about our normal business. I think I think we're going to encounter a new normal for us. It may be that we continue to see some face masks for a while. It may be that we continue to see some social distancing. The handshake in and of itself, I'm sure we would have normally done that when this show started. That in and of itself we may find an alternative to that. So I think there will be a new normal after this, and I think we will definitely see a phase in, much like we saw a phase out.
Well, I'm certainly ready for the little chicken wing greeting to go away. I either want to shake hands or not do anything. Yeah, that was a silly one. I have seen folks and
the foot shake.
Yeah, the foot shake. Kicking each other's shoes. That could be fun.
It could get out of hand too.
Yeah. Well, that's incredible information. Thank you for being with us and sharing. Absolutely. Is there any other message that you think would be important for folks viewing?
Well, I just hope that folks will take advantage of the testing that we have available. Again, the more that we can understand about the burden of this disease, the better we can move forward and give to the decision makers the data that they need really for us to get back to some level of normalcy. I do want to do a shout out, honestly, to all our public health workers, my team back at the regional office, but my team also here in the McMinn County Health Department that do an outstanding job. You're never going to find a more passionate group. I heard 0 complaints on Sunday when we were out there for probably 9 hours total. They just do a fantastic job, and I'm really moved by just the passion that they've shown throughout this ordeal.
Well, thank you. And Jeannie and I have been in but in contact throughout this
6 feet
entire
apart,
thing.
right?
6 feet apart.
6 feet.
Much further than that, all
Sure.
by text message and phone call.
Right.
And email, but she's been incredible to work with, and we when at the onset of the first, I guess prior to announcing our first positive test, Jeannie, Mayor Gentry, myself, Mayor Burris, we were all together, and we all made a pact at that moment that we were going to be on the same page. We're going to be communicating before any kind of major decisions. If any decisions were to be made, we would notify all the other parties and make sure that we're communicating as best we can and getting the good message out to our citizens to make sure that they're informed. And that's really where this idea actually came from.
Right, we appreciate it very much as well. I think it's it's this kind of information that we can share almost in, really in real time. That's making a lot of the difference. So we appreciate it very much. I appreciate you having me today.
Yeah, you've been a wonderful guest.
Thank you.
I would like to do something like this again, but I hope we don't have to.
Not in my career, anyways.
Yeah. I know this has been wonderful information for the folks viewing, our Athenians and McMinn out there. So thank you very much, Glenn.
Absolutely.
All right. I do have a few other announcements I'll share with you now. Our COVID-19 resources, there is a new page on tn.gov. If you'll go under the Governor's tab, so tn.gov, and under the Governor's tab on there, you can scroll down and you'll see a whole list of resources for COVID-19. Everything from health to help with unemployment, economic recovery, what our business owners need to know. So there's a whole list of COVID-19 resources for Tennesseans on tn.gov under the Governor's tab. So go there and look. However you're affected right now, there's likely a resource, guidelines, there's help for you on that page. Next week, as we have heard and seen in the news, Governor Lee intends to begin a slow approach to reopening Tennessee, reopening some of those businesses that have been closed, maybe reopening restaurants to a certain level, but by no means should we expect that next Friday, May 1st, that everything's wide open again. We will still be under a COVID-19 threat as we are today. It will still be important, likely, to social distance. It will still be important to use proper hygiene. Maybe to wear masks and gloves when we do have to be in contact with other people. So that's important for you to know and for you to be prepared for that. This will not be an immediate, all open type of scenario. We don't know exactly what it's going to look like, but there is a team of professionals in place building that program out, and we're going to hear about that next week. And so let's be ready for that, and let's also be ready to hear that maybe we might not be able to get our hair cut next Friday. That may be the deal. So we have to be cautious, and we'll be paying attention, and we'll be waiting to hear what the plan is from our governor's office. And so that stay-at-home order and the business closures that exist today still exist through April 30th at least. And then there will be new procedures. There will be some new way of us transacting business as we reopen the state of Tennessee. And so I have called upon the Council Advisory Committee with the City of Athens. Ms. Patty Greek is going to lead that up. And we're already seeing some good response from that team to serve as the Athens Economic Recovery Team. And so they're beginning to build out a plan of what this looks like, not just for the state of Tennessee and what our governor will be looking at, but how does this affect Athenians and our local businesses? We are actually building that program out now, and we'll be responding and reporting that out to you at the end of next week as well, to coincide with the governor's announcements. So be looking for that, and if you have any input to share, please do so. Please call us here at the City of Athens. Please connect with us and let us know your thoughts and how we could be of service to you during this time. So stay tuned for all of that good information. Tomorrow on the Daily Update, I'll have Mr. Kevin Lane with Coordinated Charities talking about the good work that he is doing and his team is doing, helping to serve vulnerable populations in our community. And then next week we'll focus on higher education. We'll be looking at TCAT and also Tennessee Wesleyan University, and we'll bring Athens City Schools back into the mix because there will be some new announcements to talk about our students, our Athens City Schools. So we'll do that, and then we'll lead into the economic recovery plan at the end of next week. Look forward to reconnecting with you here again tomorrow with Mr. Kevin Lane. And I do have one other thing. I was reading the Daily Post Athenian today, and I saw a wonderful advertisement that they had put in there. This may be difficult for you to see, but grab your Daily Post Athenian. We'll zoom in on this. But you have all of the local restaurants that are open and catering to you for pickup, drive-through, so you can use our local restaurants. They are open. You can get in there and get your favorite food and your meal and take it home and enjoy that. And so I was very happy to see that and happy to support our local businesses during this time as they have been affected by COVID-19 and having to be shut down right now. Closed to sit-down, dine-in type meals. But you can get your favorite meal from your restaurant locally, and they're all listed in today's Daily Post Athenian. So I want to share that with you as we sign off here today. May God bless you, and may God bless Athens.